Today, we're diving into something that affects almost all of us, but we probably don't think about it much. Why do medicines come in so many different forms? As it turns out, the path a drug takes to get into your body is every bit as important as the drug itself. Okay, let's get into it.
I mean, think about it. You've probably been there. Your doctor gives you a pill for one thing, a shot for another, maybe a cream for something else. It can feel a little random, can it? But there's actually a fascinating science behind choosing the perfect path for a medicine to get in and do its job.
So the key idea here has a bit of a formal name, the route of administration. All that means is the path a drug takes into your body. And that path, well, it changes everything. It dictates how fast a drug kicks in and, maybe most importantly, how much of it, what we call its bioavailability, actually makes it into your system to work its magic.
So let's start with the one we all know and, well, maybe don't love, but it's familiar: taking a pill. This is, hands down, the most common and convenient way to take medicine. But the journey that little pill takes is surprisingly complicated. See, when you swallow a pill, it's not a direct flight. It's more like a long road trip with a mandatory and kind of rough stopover. It has to survive your stomach acid, get absorbed by your intestines, and then, here's the biggest hurdle, it gets sent straight to the liver. Think of the liver as a super strict toll booth or a security checkpoint. It metabolizes or breaks down a huge chunk of the drug before it ever reaches the rest of your body. It's called the first pass effect, and it means only a fraction of what you swallowed actually gets to work. So yeah, the pill is a classic trade-off. It's easy, you don't need a needle, you can take it anywhere. That's the upside. But the downside, it's slow to start working, its strength gets watered down by that liver toll booth, and sometimes it can really upset your stomach. And that, right there, is why we need other options.
So what happens when a pill is just too slow or too weak? You need a more direct route. You need an injection. When you need a drug to work fast and at its full intended strength, you've got to bypass that whole digestive system. It's the only way to go in an emergency.
This chart tells the whole story, loud and clear. With an intravenous or IV shot, you get 100% bioavailability. The entire dose goes right into your bloodstream, instantly. Now compare that to a pill, where that liver toll booth might leave you with less than half the drug doing any good. Even an intramuscular shot, like a vaccine in your arm, is way more efficient. The difference is just huge. But not all shots are created equal. An IV is like the Formula One of drug delivery. It's immediate, super precise, and essential in a hospital for things like chemotherapy or rehydration. An intramuscular or IM shot is more like a high-speed train. It's still really, really fast, just not instant, which makes it perfect for things like vaccines or antibiotics at your doctor's office.
Okay, but needles aren't the only way to sneak past the digestive system. There are other, way less invasive ways to do it. Some might say they're clever little shortcuts.
For example, have you ever heard of sublingual administration? This is where you place a drug under your tongue. Why there? Because that area is packed with tiny blood vessels just waiting to absorb things. The drug dissolves, and whoosh, it zips right into your bloodstream, completely avoiding that first-pass metabolism in the liver. It's an incredible hack, and it's why it's used for drugs like nitroglycerin during a heart emergency, when every single second counts.
And then you have the topical route, just putting medicine on your skin. The real beauty here is that it's a targeted strike. You treat one specific spot, say a rash, which means you minimize side effects for your whole body. So what's the catch? Well, our skin is a fantastic barrier. It's designed to keep things out. So only very small drug molecules can sneak through, and you never know exactly how much will be absorbed.
All right, so let's shift gears and look at what many people think is the real high-tech frontier of all this: inhalation. That's right, just breathing in your medicine. It can be a mind-blowingly efficient way to get a drug exactly where it needs to be.
Now, inhaler tech has been around since the 50s, but it took a huge leap forward in the 90s, and you'll never guess why. The propellants in the old inhalers were banned because they were bad for the ozone layer, so this environmental crisis actually forced scientists to get creative and invent much smarter, much better devices. Necessity really is the mother of invention.
And if you want to see just how powerful this route is, just look at this number.
For the common asthma drug salbutamol, you need about 2 milligrams if you take it as a pill. But with an inhaler, you only need 0.2 milligrams. That is 10 times less medicine for the exact same effect. Delivering it straight to the lungs is just that much more efficient. But it's not a perfect system. A lot can still go wrong. A good chunk of the drug can just get stuck in the back of your throat. And as anyone who's used an inhaler knows, trying to coordinate pushing the button and breathing in at the exact right moment, it's really tricky. Patient error is still a major hurdle. But despite those challenges, the future here is just incredibly exciting. Researchers are now figuring out how to deliver really complex drugs this way, things that go way beyond just respiratory diseases. We could be looking at a future where we treat a whole range of conditions simply by taking a breath. So, from a simple pill to a puff of air, it's clear that the journey a drug takes into our body is a story of trade-offs: speed versus convenience, power versus side effects. The route is truly just as important as the drug itself, which really makes you wonder, what's the next great delivery innovation going to be?